Are you or someone you know struggling with marijuana withdrawal? Wondering what to expect and how to cope? In this video, we'll break down the symptoms, timeline, and effective strategies to help you navigate this challenging journey. Stay tuned to learn how you can jumpstart your recovery and get back to the life you deserve. What to expect from marijuana withdrawal, a comprehensive guide. Welcome to Dr. Quid Telehealth Clinic. I'm Dr. Eric, and today we're diving into an important topic that my patients often ask about: marijuana withdrawal. Whether you're considering quitting or supporting someone through this process, understanding what to expect can make a significant difference. Let's get started. First, let's talk about what marijuana withdrawal is. When someone who uses marijuana regularly stops, their body and mind need time to adjust to the absence of THC, the psychoactive compound in cannabis. This adjustment period is what we refer to as withdrawal. Regularly means daily use, or even as little as 1 to 2 times per week, can cause uncomfortable symptoms when you stop. What are the withdrawal symptoms? Withdrawal symptoms can vary from person to person, but some of the most common include irritability, anxiety, sleep disturbances, decreased appetite, depression, physical discomforts like headaches, muscle cramps, or stomach pains, and of course, cravings for marijuana. But why do I feel this when I stop? So you feel these withdrawal symptoms because whatever benefits the THC gives you, it takes away when you stop. So even though you may not have been using it to treat pain, nausea, appetite, sleep, anxiety, muscle tightness, or headaches, it was still providing those effects the entire time. And guess what? When you take something away from the body that it's gotten used to, you will notice when you stop. And when you stop, it will take some time for those things to get rebalanced. Until then, your body may overcompensate and give you the opposite effects. How long will it take for my body to rebalance? Understanding the timeline of these symptoms can help you prepare. Typically, symptoms begin within the first 24 to 72 hours after quitting, peak around the first week, and gradually decrease over the next 2 weeks. However, some people might experience lingering effects for several weeks, depending on how heavy of a user you were. A common timeline I see from patients is this. The first day, you may experience anxiety, cravings, low appetite, boredom, and difficulty sleeping. This typically increases over the first 72 hours, with possible headaches, muscle cramps, joint aches, as well as nausea, and possibly dry vomiting. Patients that are heavy users may even find more severe symptoms, like actual vomiting, inability to sleep for multiple days, and a high degree of achy pain with bouts of anxiety and panic. Now, this is likely to fade, but if things continue to be severe, then this could be the dreaded cannabinoid hyperemesis syndrome. We will do a separate video on that in more detail, but if you are unable to keep down liquids and food after several days, you may need to seek medical help. Thankfully, however, most people do not have symptoms that severe, and after a few days, the symptoms improve and fade over the course of 1 to 2 weeks. These symptoms may sound scary, but don't worry. There are things that I advise my patients try to feel better sooner. Are there things I can do to help feel better sooner? Are there things that I should avoid doing? Now let's talk about coping strategies. Here are some effective methods to manage withdrawal symptoms, but I will be doing a separate, more focused video on this later. Diet. Typically, I recommend a bland diet, healthy foods mostly, as best as you can. You may not have a taste for too much else. Fluids, magnesium supplements, potentially put salt on various items to prevent muscle cramping. Really, whatever food you can handle. This does typically improve after 1 to 2 weeks. Exercise. Walking, stretching, yoga, maybe swimming if you can. You may want to avoid doing a heavy workout due to possible pain sensitivity and achiness, but get in the habit of moving around when you feel irritable. Good to have something to replace what you previously did. With smoking, it helps get rid of that irritability, anxiety, possible depression. As far as emotional needs, you want to identify your emotions, let them pass, and then build relaxation through breathing and support. Lean on friends and family, possibly reach out to professionals if you need, but you definitely want to focus on reducing your emotions and reducing your exposure to serious or stressful things before bed. Leading into bedtime, you'll certainly want to focus on calming down, especially if this is often when people would otherwise be using, so you'll really want to focus on a replacement in the hours leading into that. For sleep, this can be a bad one for many people. Really try to make it the first few nights without using melatonin or Benadryl, maybe without any medication scripts from doctors, or certainly not by relapsing to more THC and restarting the process again. Don't switch to alcohol to calm yourself down. You really want to allow your body to heal naturally and restore its own ability to calm and begin the sleep cycle. Now, those struggling with severe insomnia may benefit from small amounts of edibles to sleep, but that's something that should be discussed with your doctor to titrate down properly instead of just continuing to use against your goals and possibly getting right back into where you started. In the course of 30 days, you may notice more dreaming. This is normal due to improved REM sleep at THC limits. Nap if you can. Try some light teas like passion flower, mint, or chamomile. For focus, even though you are fatigued from poor sleep and scatterbrain, caffeine should be avoided. You don't want to risk interfering with your natural sleep restoration in any way. Take deep breath and give yourself a break. Your focus will improve in time. You may want to speak to others and ask for more patience regarding extra time or repeating themselves, and consider taking off time from work. You can try walking, stretching, or yoga, possibly a warming pad or even a hot tub rather than Tylenol, which might be used as a last resort. For cannabinoid hyperemesis syndrome, the more severe symptom can be improved with a hot shower, actually, or potentially going into a hot tub. But major relief may also signify that you have a permanent condition that's going to happen every time you continue to reuse the THCs. Once you start feeling better, hopefully you won't need to go to the emergency room, but you might if you're not able to stop vomiting or keeping things down. But that's a big sign that you should not likely use it again. What if I relapse? Relapse is a common part of the quitting process. If it happens, don't be discouraged. Reflect on what has led to the relapse and adjust your plan as needed. Seeking support can also be beneficial. Please comment below with questions and tips that you found helpful and learned as you quit using yourself. Maybe you could leave something for other people to benefit from, or any other questions that you may have about quitting. We could start up a discussion below. What about after I start feeling better? By day 30, you should physically feel back to normal, although with very heavy use, you still may test positive for a drug screen up to 45 days or even longer. Continuing not to use at this point is all about managing triggers and spending time identifying why you use THC. This can be done with the guidance of a medical professional or with self-directing learning, such as using one of our free graphics that helps you delve into why you started using in the first place. Feel free to check out some of our videos listed previously regarding finding out why you use. Tackling your anxiety and depression or other mental health ailments that THC was covering up is going to be crucial. Staying away from relapsing and coping in healthier ways. Once again, see our graphics or our chart. Pro tip for success: change your patterns of behavior. The number one tip for success is changing your playgrounds and your playmates. It helps to limit those automated reflexive behaviors when you are with new people in a new space to have a truly clean start. When to seek professional help. It's important to know when to seek professional help. If you or someone you know is struggling with severe symptoms or finding it difficult to cope, consulting with a healthcare provider can provide you additional support. No one can force you to quit, but at Dr. Quit Telehealth Clinic, we offer personalized guidance to help you through this process and provide you with a detailed plan to quit in whatever timeline you wish. Here's a good recap quickly. Since your body was used to using THC to help you with certain symptoms, whenever you take it away, you feel crappy without. That means that you're going to feel irritable, anxious, sleep issues, difficulty eating. You might be nauseous. You could potentially vomit or have dry heaving. Physical discomforts like headaches, muscle cramps, stomach pains, anxiety, depression for a few days or up to a few weeks. To feel better, try a bland diet. Just eat anything that you really can. Focus on healthy foods, walking, stretching. Hot tub is incredible. Focus on really whatever food you can eat to prevent muscle cramping. You'll want to add some salt to things or consider taking magnesium. Emotionally, you want to identify, let those things pass, and build relaxation through breathing and support. And for pain, you'll want to consider a hot tub. A hot tub can also be an excellent choice for cannabinoid hyperemesis syndrome. Also a hot shower. Relapse is common and expected from time to time, but stay on the path. And if you're tired of trying alone, click here for professional guidance from Dr. Quit. Quitting marijuana can be challenging, but understanding what to expect and having a plan can make a significant difference. Remember, you're not alone on this journey. At Dr. Quit Telehealth Clinic, we're here to support you every step of the way. If you found this video helpful, please share it with a friend. Subscribe for more health tips and information. Thank you for watching.